Matthew Show from the Citizens Bank Studio. I really enjoyed that conversation with Adele. What they're doing at the Coast Chamber is really, really terrific. And as I mentioned at the beginning of the show, this is a new edition of Singing River Health Talk, done in partnership with Singing River Health Systems. And I've really enjoyed it. The feedback's been terrific, but I'll be honest with you, for me, it's been a great opportunity to visit with a health professional each week and to get to know them better. The people who are working so hard to help people in coastal Mississippi. And so this has been a great addition to my show. I want to thank Singing River Health System for doing this. And today's just another edition of Singing River Health Talk. Okay, today we're going to have a terrific conversation today. I had a chance to visit with Dr. Timothy Haffey before we started the show. He's an ENT doctor, but he's a facial plastic surgeon, head and neck surgeon. We'll get into some details about what he's all about. But he is, as I mentioned at the beginning of the show, another in a long line of physicians that have come through Keesler Air Force Base. And when you see Dr. Haffey's background, you'll be very impressed that we're able to capture someone like him who loves coastal Mississippi and is working here now. Without any further ado, let me introduce you to Dr. Timothy Haffey. How you doing, Doc?
I'm good. Thanks for having me. It's a pleasure to be here.
It's good to see you, too. Where are you sitting right now?
In my office right now. I'm actually just taking a little break from clinic. I'm in the middle of clinic seeing patients, but...
Yeah, well, good. What was interesting, I mean, you heard what I said about Keesler, but it's true. I mean, the quality doctors that are coming through Keesler, it's incredible. And many of them decide to stay here.
Yeah. I mean, to be frank, I grew up in Michigan, so the coastal Mississippi was not really on my radar without the Air Force bringing me down here. And we pretty quickly fell in love with the coast. And I moved down here in 2014, active duty Air Force, and spent about 9 years straight at Keesler. So had plenty of time to get to know the people here and kind of get a feel for the medical field and kind of the culture of everything down here. And we really fell in love with it.
Hey, where in Michigan are you from?
So Metro Detroit area. I grew up, I'm the youngest of four. And like a lot of people outside Detroit, it's called the Motor City for a reason. My dad was an engineer at Ford Motor Company for a long time, and most of the men in my family are mechanical engineers. But I grew up about 45 minutes outside Detroit.
Michigan's a special place. I had the opportunity to spend a little bit of time there during my career. Of course, you went to Michigan State University, and you did training at Cleveland Clinic. I had a friend of mine, in fact, I just talked to him on just this morning, went for a heart procedure at Cleveland Clinic last week. And I mean, they continue to do miraculous work there, don't they?
Yeah, it's a pretty special place. I mean, especially for, they call themselves kind of jokingly a quaternary referral center, because even tertiary centers send to them. But they draw patients from all over the world, and they're doing, really cutting edge, brand new, high tech stuff there all the time. It was really one of the bigger honors of my life to be able to train there under some of those guys that are literally the best in the world at what they're doing.
It's literally true. It's literally true.
Yeah.
And so you had that terrific training. And if I have the dates right, 2008 to 2023, you served in the Air Force. Where did that bring you?
Well, I was active duty for 15 years, and then the majority of that was actually at Keesler Air Force Base here. And, I really enjoyed my time serving in the military and met a lot of really good people. And I really enjoyed my practice, actually. I came from Cleveland Clinic and was doing real big head and neck and facial plastics, complex reconstructive surgeries there. And then I moved to Mississippi Gulf Coast and didn't really know if we were going to be able to do any of that kind of stuff here. And I was able to build up a kind of complex reconstruction and head and neck cancer practice while I was in the military. And there's really nobody around that does it. I was surprised to see that the Gulf Coast is really underserved in terms of head and neck cancer care and really complex facial plastics care, where most everybody in the area was going out of town or even out of the state to go get complex surgical care for head and neck cancer. And so I really enjoyed building a practice and kind of a program at Keesler Air Force Base. And then towards the end of my active duty career, kind of started to partner with Singing River and doing some of that stuff over here. And it transitioned well into a full-time practice as I transitioned out of active duty. I'm actually still a reservist. I'm what's called an IMA reservist at Keesler, but I only go there, every month or every other month. It's not a real busy practice.
One of the things that I mentioned to you before the show started, I went to paramedic school at the University of Alabama in Birmingham, and while I was there, I got pretty close to an ENT doctor. He was also a facial surgeon. And what I was impressed about is his ability to connect with his patients. I mean, he really was in it he loved medicine. He loved working to help people find normality again, or finding their new normal, and trying to help them overcome, in some cases, as you're dealing with cancers and other issues, can be very deformative, and something that was really passionate about. And reading about you seem to have that same passion.
I do love it. It matches very good with my personality, I think. And really, especially head and neck cancer care and facial plastics reconstruction. I mean, your work is on a billboard, so to speak, walking all over the place. So I like trying to have that attention to detail and the quality control of having to do a good job, because everybody's going to be able to see what you did. And it really can be transformative for patients, like you said. I mean, it makes a big difference, both functionally reconstructing somebody and cosmetically reconstructing them so they can try to get their life back.
I bet, I can see, just in the way you communicate, that you have an ability to connect with patients, and gosh, that's so important. Any doctor needs to have that ability to connect and care and so on. But I bet, because of the nature of the conditions that you're dealing with and the work that you have to do, I bet you're finding patients on a regular basis that literally inspire you, with their outlook on how they overcome their storm, whatever it might be. That's got to be emboldening to you.
It is. Resilience is a real thing. I mean, and you see a difference in outcomes, I think, frankly, between people that have a positive attitude and have resilience toward their cancer diagnosis and those that don't. A lot of that is family support. It's a lot easier taking care of patients that have got a good family support and a good support system. I think that really adds to the resilient side of care.
Yeah, I bet it does. One of the constant themes on this show, you and I chatted a bit about it before we got started, but the way new technology is emerging to help you do what you do, to make it now. I mean, case of reconstruction, I guess you still are thinking in terms of as less invasive as you can possibly be, but the reality is technology is really helping you have better outcomes, isn't it?
It is, and it really changes the game in terms of reconstruction. So I kind of trained in the era where a lot of it was done kind of the old-fashioned way. We'll do, for instance, especially with real big reconstructive surgeries, if somebody's got a jaw cancer and we have to take their whole jaw off, I might take their fibula bone from their leg and reconstruct their jaw and hook up the blood vessels in their neck so that jawbone has got its own blood supply. Well, now there's a lot of 3D printing and even 3D modeling that you can do of the actual patient's fibula and the actual patient's jaw and tumor before you even do the resection, that can help you come into the surgery with a plan and even a titanium plate that is made specific to their reconstruction and to their bone, so that you're more exact in your reconstruction. So technology in that fashion has really changed a lot.
Wow, I can imagine how much. I mean, I understand the complexity of what you just mentioned, but the precision that's required, and beyond that, I mean, you just want an outcome where people can look in the mirror and not be so distraught. I mean, at the end of the day, I mean, that sounds transformative to me.
Yeah, they're pretty cool surgeries to be part of. I'm still, I'm sort of mid-career, but I still have not lost really almost the magical view of sitting there in the middle of a big surgery and still amazed that we're able to do what we're able to do and that we can still get good outcomes for these people. I mean, I really enjoy my job, and I do come home blessed that I'm able to do this, and with that gratitude, or that feeling of gratitude, that people trust me in their care, and that I'm always going to do the best I can to try and serve them. I hope that comes
Everything
across to my
about
patients.
Yeah, everything about what you said shared with me just then in our radio audience and our video audience. What it shared is an incredible empathy that you can be still in the surgery room and looking at the outcome of your surgery, knowing that when they wake up from their from the anesthesia and look in the mirror, that you've given them something they can be proud of, that they can say, you know what, I'm working my way toward recovery and my new normal. And I mean, it's a beautiful thing to say, man. I know you know that. I know, but the fact that you're saying you're mid-career and still not numb to that reality, that's when you can put skill and experience together with heart. I mean, you can't have in most cases, you can't have a bad outcome. Listen, when we come back, we'll continue our conversation with Dr. Timothy Haffey. I want to get into actually Head and Neck Cancer Awareness Month is actually going on right now. And we're going to talk about what are the implications, what are the kind of things people need to be thinking about as it relates to that. We'll see you after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio, and we're in the midst of Singing River Health Talk. What a great addition to this show. I'm so thankful to Singing River Health System that we had this opportunity each week to visit with someone like Dr. Timothy Haffey, who I'm sincerely enjoying spending time with. Our chats during the break is probably something we should have taped, because we talked about mentorship and how we've both been influenced throughout our lives, and how as we get a little bit older, we can have the same kind of influence on others. It was a really terrific kind of personal reflection about where both of us are in our lives. But as we said when we went to break, Dr. Haffey, April is Head and Neck Cancer Awareness Month. And it seems like in all of the conversations, the fact that Mississippi probably doesn't eat the best diets, 51% of the people live in rural areas, maybe they smoke, maybe they do chewing tobacco. There's all kinds of risk factors. But as we think about April being Head and Neck Cancer Awareness Month, what are the kind of things that you like to make sure people are aware of?
Yeah. So, I mean, head and neck cancer is unfortunately becoming a little bit more prevalent. It's probably about 4% of all of the cancers diagnosed in the U.S. annually. It's definitely not one of the big ones like colon cancer or breast cancer or skin cancer, but especially down in coastal Mississippi, there seems to be a relatively high proportion of people that come in with head and neck cancer. And some of the risk factors you think about, it kind of goes with the culture down here of being outdoors, doing boating. Like you said, it's a lot of tobacco products, so smoking and chewing tobacco, excessive alcohol intake. And then one of the newer things that's really come up over the past few decades is the human papillomavirus as a cause for oropharyngeal cancer specifically, meaning tonsil and tongue-based cancer. And it's really become an epidemic, which is nationwide, that this human papillomavirus, and in particularly there's a couple of strains, this strain 16 and 18 are the ones that are oncogenic or cause cancers. It's really changing the epidemiology of head and neck cancer. So sort of traditionally, head and neck cancer was diagnosed later in life, in the later generations, because it really took a whole lifetime of smoking and drinking to put you at risk of developing one of these cancers. And now we were seeing younger and younger people getting head and neck cancer, and oftentimes they don't smoke or even really drink that much. And so we kind of looked into the epidemiology of this, trying to figure out what exactly was causing it. And a big thing that's causing it is this human papillomavirus, which is the same virus that causes cervical cancer in women and can cause warts. The lower risk virus strains can cause warts and papillomas.
Wow, that's kind of scary when you think about increased prevalence. But 4% of all cancers, I mean, in the scheme of things, that's still a pretty big number, isn't it?
Yeah, it is. It's somewhere like 17 to 18,000 cancers nationwide every year. So it's not a small number, unfortunately.
Hey, so listen, we have like 3 minutes left. I want to make sure we capture your team, the other doctor that you're practicing with, and the other members of your team. Tell us about that.
Yeah, so the two physicians in our practice right now are myself and Dr. Eric Rasmussen. who is a great guy. I worked with him. He's was active duty military as well. We worked together at Keesler for about 6 years before we both came over to Singing River. And then we've been lucky enough to have 2 mid-levels that we've hired on. Anna is a mid-level that works mainly with me doing facial plastics and head and neck cancer. And then Catherine works with Dr. Raz doing more of the general ENT side of things. But it's a really good group of people. And then we've got all of the clinic staff that are really phenomenal. We're really blessed to have the team of people that we have here.
So what offices are you typically working out of?
So right now, today I'm in the Pascagoula clinic, and that was the first office that we started. So both myself and Dr. Raz will work out of the Pascagoula clinic, and then this year we opened up an Ocean Springs clinic as well, kind of behind the emergency room at Ocean Springs Hospital. So we can start to serve that population as well, and we plan on building that footprint even bigger. As the population seems to be growing a lot in Ocean Springs, so I think that'll be a good place to be as well.
Yeah, there's really, really no doubt about that. You get into other areas. Why don't you just we got maybe a minute left, but some of the other areas you're working in.
You mean in terms of practicing medicine?
Yeah, like facial plastic surgery.
Yeah,
facial.
As far as my practice, I do a lot of head and neck cancer. I do a lot of head and neck cancer reconstruction, so complex facial plastics reconstruction. Then I do the whole gamut of both functional and aesthetic facial plastic surgery. So both cosmetic rhinoplasty or functional rhinoplasty or fixing your nose so you can breathe better if you've got structural problems. We do, both oculoplastic, meaning brow lifts, eye lifts, those kind of surgeries. I do facial reanimation surgery if you've had facial paralysis from Bell's palsy or from a cancer or something like that, and we need to try and give your face more symmetry. And then my partner covers all the general ENT. So he's doing a lot of the tubes and tonsils and a lot of the sinus work and that kind of stuff.
Well, listen, it's like I said, it's been a pleasure. You and I could have gone on for another 2 segments, but I really appreciate you spending some time with me today.
Yeah, I appreciate you inviting me on. It's been a pleasure.
It has been great. This has been Dr. Timothy Haffey. He's an ENT and facial plastic surgeon, among other things, extraordinarily well trained with Singing River Health System. This has been Singing River Health Talk. And as usual, I enjoyed the heck out of it. It's been terrific. Listen, have a great day, and we'll see you tomorrow.